Mental health is changing. Earlier this year, the federal government gave the green light to researchers to explore psychedelic-based treatments for certain patients.
And with this new focus on these alternative medicines, there's growing interest here in South Florida in ketamine therapy, which, as Jawan mentioned, can have psychedelic effects. NBC 6 reporter Sofia Hernandez explains.
It really started around COVID, where there was a lot of trauma. A lot of people were very cut off.
Stephen Radowitz is the chief medical officer of Nushama, a clinic offering ketamine therapy in Aventura.
People who are really stuck in some past trauma, past difficult life events that have not been properly processed. They've been through therapy, they've been through many medication trials, and they feel like they just don't know where to go. These are the majority of the people who come in here, and they do incredibly well.
Ketamine is FDA approved as an anesthetic and a nasal treatment used to treat depression. While not FDA approved when used in other forms, it is legal. At Nushama, the ketamine is given through a controlled IV drip to treat various psychiatric illnesses.
So what the ketamine does is it opens up those neural pathways, allows the brain to work in a little more free flow, and makes us more open to different perspectives.
Cleveland Clinic warns those specifically with substance use disorder and depression may have adverse effects like addiction to recreational ketamine use, as seen in the tragic death of Matthew Perry. But Dr. Lena Agius with Florida International University explains patients who are approved for this clinical treatment will likely not get addicted because the dosage is low. And while some can experience psychedelic symptoms, she states ketamine should not be compared to classic psychedelics like LSD or psilocybin.
The risks for misuse or abuse are more relating to someone not having the proper guidance, medical clearance, and the support around the ketamine experience.
She notes because ketamine therapy is not FDA approved, it can be costly, and it's important to find providers who are trained in proper administration of the drug and have a background in mental health. In April of this year, a federal executive order was issued to accelerate research around Schedule I psychedelic and psychoactive treatments to treat severe mental illnesses. While ketamine doesn't fall under this category, healthcare providers, like the ones at Nushama, believe with more exploration of how psychedelics can benefit mental health, the future for treatments could look very different.
And I think in the future, we'll probably be using different types of psychedelic medicine to get people through their problems.
According to the National Institutes of Health, ketamine can raise blood pressure and heart rates for certain patients. And Dr. Lena says for patients suffering from depression or other mental health illnesses and find that ketamine therapy is not working for them, she asks that you don't lose hope, but explore other treatment options. A list is on our website, NBC6.com. Sofia Hernandez, NBC6 News.